Hi, I'm Medicare Dana, your personal Medicare agent extraordinaire. I'm going to walk you through the entire Medicare process in simple and understandable ways. With the amount of information out there, it can be really hard to make sense of it all. Your medical and financial security are directly tied to your Medicare plan, making it so important that you understand the full program and all of your options. This video will give you an overview of what you need to know if you are working past the age of 65. So kick back and join me for a coffee or a tea, and let's get to work. Oh, you might want to grab a pen and paper to jot down notes. If you forget to write something down, you can always come back and rewatch this video at any time on my YouTube channel, Medicare Dana. Oh, be sure to subscribe. And my website, MedicareDana.com. Okay, let's jump in. If you or your spouse are still working past the age of 65, Medicare works a little differently. Whether you need to sign up for Medicare depends on two important factors. One, how you get your health insurance now, and two, the number of employees that are in the company where you or your spouse work. Before we get too into the details, I want to clarify that working means active employment, not retired. All right, let's jump into the specifics. So if you or your spouse work for an employer or company with 20 or more employees and are enrolled in their group health insurance plan, you can delay Medicare without penalty. On the other hand, if you or your spouse work for an employer or company with less than 20 employees, typically, you will need to sign up for Medicare when you turn 65 to avoid penalties and to ensure your insurance claims are paid. This all boils down to what Medicare considers creditable coverage and who pays claims first, Medicare or the group insurance plan. If you or your spouse's employer or company have less than 20 employees, Medicare pays first for services, and your job-based insurance pays second. If you do not sign up for Part A and Part B, your job-based insurance might not cover the cost for services you get, and you may incur a late enrollment penalty for Medicare. If you or your spouse's employer or company have more than 20 employees, your job-based insurance pays first, and Medicare pays second. In this situation, you do not need to enroll in Medicare. If you qualify for premium-free Part A, you can and should enroll in Medicare Part A only. As for Medicare Part B, you can wait until you stop working or lose your group health insurance if that happens first to sign up, and you won't pay a late enrollment penalty. A very, very important detail for those who fall into this category are restrictions around Medicare Part A enrollment. If you contribute to a health savings account, also known as an HSA, you should not enroll in Medicare Part A. You cannot contribute to an HSA and be enrolled in Medicare at the same time. If you do, you may obtain tax penalties. If you or your spouse get a stipend from your employer to buy your own health insurance, or if you or your spouse are still working but don't have health insurance through that job, generally that isn't considered creditable coverage and you need to enroll in Medicare. Once you sign up, Medicare pays first. Some private insurance companies have rules that lower what they pay, or worse yet, don't pay at all for insurance services you obtain if you're eligible for other coverage like Medicare. Meaning, if you are eligible for Medicare and do not enroll, they may not cover your claims. If you have COBRA, you should sign up for Medicare when you turn 65 to avoid gaps in coverage and to avoid a monthly Medicare Part B late enrollment penalty. Medicare pays first once you turn 65. So if you do not enroll in Medicare when you turn 65 while you're on COBRA, COBRA may not pay your claim since you are now Medicare eligible. So many people lack knowledge about the Medicare program, putting them at risk of making a poor decision on their Medicare coverage. Don't let this happen to you or the ones you care about. Your medical and financial security are directly tied to your Medicare plan. Understanding the program, all of your options, and the financial implications is important so that you can plan for your future. To help you get the most appropriate Medicare plan for your needs and answer all your Medicare questions, contact me, Medicare Dana, your personal Medicare agent extraordinaire. Visit my website, MedicareDana.com, subscribe to my YouTube channel at Medicare Dana, follow me on Facebook at Medicare Dana, and connect with me on LinkedIn. I can't wait to hear from you.